You probably wouldn't say it out loud, not at the gym, not at work, maybe not even to your closest friend. But let me ask you directly, have you ever quietly wondered, am I normal? You're not alone. In fact, surveys show that more than half of men worry about their size, even though the majority of their partners are perfectly satisfied. And yet, the internet is flooded with quick fixes, miracle pills, and shady procedures that promise results, but often leave men frustrated, anxious, or even worse off than when they started. So today, I want to cut through the noise, and I'm going to walk you through what the science actually says about increasing penile length, what works, what doesn't, and what every man over 40 should know to protect his health, dignity, and confidence. But before we go further, quick pause. If you value honest, evidence-based health advice, go ahead and hit subscribe, and drop a comment telling me where you're watching from. It helps this channel reach more men who need to hear this conversation. All right, let's dive in. Here's the truth no one tells you. Most men who worry about their size are actually completely normal. The average erect penile length is about 5.2 inches, and almost everyone falls within a healthy range around that. But the problem isn't the body. It's the mind. A condition called small penis anxiety has become increasingly common. This is when men spend an hour or more a day obsessing over their size, even though biologically they're completely within normal limits. And it's not just harmless overthinking. This anxiety can wreck self-esteem, damage relationships, and even lead to depression. So before we talk about devices, surgeries, or treatments, we need to bust the biggest myth of all, that your worth as a man is defined by a number on a ruler. It's not. That said, science does give us some options, and that's where I step in. If we haven't met yet, hi, I'm Dr. Melinda, a board-certified urologist with over 10 years of experience helping men take control of their sexual and urinary health. I've spent my career separating fact from fiction, not just in textbooks, but in real conversations with thousands of men who've sat across from me, anxious, embarrassed, or simply curious about this exact question. And here's my promise to you. I will never give you hype. I'll give you evidence. So let's walk through the 5 biggest habits and mistakes men make when it comes to penile length, and what the science says about changing them. Habit number 5, obsessing over porn comparisons. Let's start with the invisible trap, unrealistic comparisons. Pornography has completely skewed men's perception of what's normal. You see carefully selected performers, often in the top 1% for size, and suddenly your brain rewires itself to believe you're inadequate. Biologically, your body hasn't changed, but your brain chemistry has. Dopamine spikes from repeated viewing create distorted benchmarks. Emotionally, that comparison slowly chips away at confidence. You may feel embarrassed, avoid intimacy, or even develop performance anxiety. Practically, the fix isn't to quit intimacy. It's to quit the unrealistic measuring stick. Remind yourself that your partner cares more about connection, presence, and performance than inches on a tape measure. What about actual physical changes? Let's go there. Habit number 4, chasing miracle pills or injections. Type "how to get bigger" into Google, and you'll drown in advertisements. Herbal supplements, male enhancement pills, and injectable cocktails that claim to transform your body overnight. Here's the hard truth. None of these have been proven to safely or consistently increase penile length. Biologically, many of these injections cause scar tissue, deformities, or even permanent erectile dysfunction, sometimes decades later. Emotionally, men go in with hope, but many come out with regret and shame when things go wrong. Practically, please, for your health, avoid putting unregulated substances into your body. Your penis is far too important to gamble with. So if pills and injections don't work, what does? Habit number 3, ignoring traction therapy. This is one of the only scientifically supported methods. Penile traction devices, when used consistently over months, have shown modest increases in length, usually around 2 centimeters. Biologically, these devices work by applying gentle, steady tension, which stimulates tissue remodeling. It's similar to how orthodontic braces reshape teeth over time. Emotionally, progress is slow and it requires patience. But for men who commit, the psychological relief of seeing measurable change can be powerful. Practically, we're talking hours of daily use, often for 6 months or more. Results are modest, not dramatic, and you must accept potential side effects like temporary numbness or bruising. But what about surgery? Is that the shortcut? Let's talk. Habit number 2, rushing into surgery without understanding the risks. Surgical lengthening procedures exist, but they are experimental and often carry significant complications. Biologically, surgeries like suspensory ligament release may make the penis appear longer when flaccid, but they don't change erect length and can destabilize erections. Other surgeries involving grafts or implants often come with poor satisfaction rates. Emotionally, many men wake up from surgery not with relief, but regret. Dissatisfaction rates are high because expectations rarely match reality. Practically, unless you're in a legitimate monitored clinical trial, surgery for lengthening is simply not worth the risk. Which brings us to the biggest mistake of all. Habit number 1, neglecting mental health. This is the core issue. Biologically, your brain is your most powerful sexual organ. Anxiety hijacks your nervous system, increases stress hormones, and actually decreases erectile function. Emotionally, when men address their anxiety through therapy or counseling, studies show that the majority no longer even feel the need for physical interventions. Practically, investing in your mental health doesn't just improve sexual confidence, it improves every part of your life. Better sleep, better relationships, better mood, better performance. So if you remember only one thing from this video, let it be this. The biggest growth you can achieve isn't in inches, it's in confidence. Here's your simple roadmap. Stop harmful comparisons. Limit porn, focus on real intimacy. Avoid scams, no pills, no injections, no shady providers. If curious, consider traction devices, but be realistic and consistent. Say no to surgery unless it's a clinical trial. The risks are too high. Prioritize your mental health. Counseling can change everything. This is how you reclaim both your health and your peace of mind. Let me pause and speak to you directly. If you've carried this worry for years, I want you to hear me. You are not broken, you are not abnormal, and you are not alone. Your value as a man is not measured in centimeters. It's measured in how you show up in your relationships, your health, and your confidence. And yes, you can absolutely improve those things at any age. So here's my challenge for you. Stop chasing myths. Start building habits that protect your body and strengthen your mind. Because at the end of the day, the greatest freedom is not wishing you were different. It's learning to live with confidence in who you are while taking smart, safe steps toward the healthiest version of yourself. If you found value in today's video, do me a favor. Hit that like button, subscribe, and comment below. What's one health habit you're focusing on this year? I'm Dr. Melinda, reminding you, your worth isn't measured in inches. It's measured in how you live. Take care of yourself because you're worth it.